Hi there, my name is Amarachi from Algochuko. I run a YouTube channel known as Ifoma Talks where we ignite healthy conversations, sexual reproductive health rights, sexual and gender based violence, humanity, empathy, friendship, lifestyle. So you can do well to check us out on YouTube. For now, we're on YouTube. However, you can follow me on Facebook, LinkedIn, Instagram, or even Twitter. So today, hmm, you can see me taking a deep breath because today's conversation is going to ignite different kind of emotions because it has always and surprisingly till now it still does. So please indulge me. I would like to kindly request that you watch this video from the beginning to the end of the clip to be able to understand clearly the full details of this conversation, and please try to reflect before you take a stand or you give your opinion, because most times why we are still having this discussion in this present age is because a lot of persons react on impulse. They've not taken time to reflect, to weigh the pros and cons of this thing, and that's why this is 2024 and we are still campaigning about this and still having this discussion, and it's unsafe termination of pregnancy, ladies and gentlemen, also known as surgical termination of pregnancy and locally known as abortion. I say locally because in house, that is what most people understand. But I choose not to use the word abortion because it gives off negative vibes at the onset. But I really want us as individuals to give room for deep thinking. Let's have this honest conversation. We can't keep shying away from it. Let us ask ourselves deep question. Let me start by asking, why are you honestly against safe termination of pregnancy? Is it because of your religion, or what you were taught, or what you heard, or what you have seen? I want you to actually give yourself 5 minutes for self evaluation. Good. Now, honestly answer, why are you against safe termination of pregnancy? Surprisingly, this is not even a Nigerian thing. It's happening across different countries. Some countries are yet to accept the fact that safe termination of pregnancy is a part of a woman's fundamental social reproductive health rights. Yes, we cannot talk about SRHR without mentioning, without giving room for safe termination of pregnancy. There are various reasons why. Let me ask, is it because it's a woman issue? Because usually when discussions are bordered on women, there's always this back and forth on like other political or on um like political matters, and we make women issues political, and it's not meant to be. As much as we women need to be factored into it, I do not think women issues should be the ground for political debate. You see politicians promising to attend to the rights of women and girls because one election is close by. No, it should be an everyday thing. I'm not one of. So, what is safe termination of pregnancy, also known as surgical termination of pregnancy? Now, I am going to be giving us the WHO definition for safe termination of pregnancy, not not my definition. WHO here defines. So according to Wikipedia, let me start from Wikipedia's definition of abortion. It says abortion is the termination of pregnancy through the removal or expulsion of an embryo or fetus. An abortion that occurs without intervention is known as a miscarriage or spontaneous abortion. When deliberate steps are taken to end the pregnancy, it is referred to an induced abortion or less frequently an induced miscarriage. Now, that being said, let me now go down to the definition of WHO's um according to WHO, abortion is termed safe when you use the following as recommended by WHO, not my recommendation. It says abortion is safe when carried out using a method recommended by WHO, appropriate to the pregnancy duration, and by someone with the necessary skills. However, when women with unwanted pregnancies face barriers to obtaining quality abortion, they often result to unsafe abortion. Now, WHO states that safe abortion, before you consider termination of pregnancy to be safe, it has to be done by somebody with the professional skills. And I am now saying that safe termination of pregnancy is actually deeper than most of us are viewing it on the surface. Look, there's a problem. There's a problem we are honestly not taking into cognizance. If we say we do not want it to be legalized or to be implemented in our country, what this means is that the rate of maternal death will be on the increase. There's already high records of cases of maternal death, and what it means is that that record which we know before is about to triple, because women who are of age to even get pregnant, who initially were medically fit to carry pregnancy, will now be left with no choice but to lose their lives because medical practitioners no longer have the outright permission to conduct safe termination of pregnancy. And safe termination of pregnancy can happen for various reasons. It includes if it is affecting the mental, physical state of the woman. Two, fetal abnormalities. This happens a lot. It plays out a lot in cases of pregnancy. You see cases whereby a woman takes in people have different reaction when they get pregnant, and it is not a one size fits all. This person experience may differ from that of the next person. And so what this means is that those who are unfortunate, those who are unlucky, who develop complications as a result of being pregnant will definitely have to lose their lives. Because if it is a case whereby the pregnancy has to be terminated, no medical practitioner will be willing to, take off that pregnancy, to take out that pregnancy. And what this automatically means is that the woman is going to lose her life. When we take out certain decisions, we are before we conclude on something, whether it is right or wrong, have we actually weighed it deeply? Have we actually reflected on it, or we're just carried away with what we think, or what our religion tells us, or what our um moral teachings or moral upbringing says? I'm saying through this video that you're watching right now, that's abolishing safe termination of pregnancy, not giving medical practitioners the right to conduct safe abortion, will do women more harm than good. Women who are of age to, you see, it is not an escape. Safe abortion is not an escape for a sexual act done. Rather, it is a means to save life. For instance, people who have been raped, rape is you being forced to have sex against your own wish. You have a chance not to raise a child who you cannot cater for. It's okay. It's okay to have safe abortion if you have been raped. There are a whole lot of damaged adults out there. There are a whole lot of adults out there who lack love simply because of the situation surrounding their birth. Either their parents had them at a time when they were not ready, or they were raped, or incest, you know, people related by blood, you taking in for your father or your brother. This is no joke. This decision is taking us back 100 years. This bridge we ought to have crossed. When we think safe abortion, what comes to our mind is one young girl who is looking for an escape route. No, it is not encouraging immorality. It is a necessity. As an individual, there are decisions, there are actions you've taken that come with heavy consequences. But you know deeply that the consequences are waiting you are very heavy. And what do? You look for solution. So why do you think advocating for safe abortion is out of place? Advocating for safe abortion is not encouraging immorality in any way. It is not encouraging immorality in any way. It is not giving room for adults to just do as they wish. No. It is you thinking that way, not what it is. It is giving room for women who medically are not certified to carry pregnancy. It is giving room for saving lives of women who medically are not fit to have children, to carry pregnancy because their life is at risk. It is giving a chance for survival of women who are not strong enough. Pregnancy happens to them and it hits them. There are cases of women going blind as a result of getting pregnant, which is not supposed to be. Such pregnancy should be terminated. Such pregnancy should be removed because it is against, they did not plan for it, they did not envisage it. People, yes, people go blind and life happens. But if a woman goes blind as a result of being pregnant and it's affecting her mental state of mind, her physical state of mind, and she wants that pregnancy removed, or medically it's been proven that this pregnancy is going to do her more harm than good, then it should be removed. It should not be contended. I don't know why we're having these discussions. It is not about me. It is about the human life involved. Why are we still having this discussion in this era? Now, let me give you an overview of the WHO abortion care guideline. It says the World Health Organization 2022 abortion care guideline offer expanded recommendations that prioritize access, safety, and quality in abortion care worldwide. It updated the previous guidelines by incorporating new evidence and recommendations to enhance abortion care services, safety, and quality worldwide. Now, the guidelines are based on human rights principles and at reducing unsafe abortions and improving health outcomes of women of improving health outcomes for women, girls, and all pregnant individuals. The objective of the WHO guideline is simple, is to present a complete set of recommendations and best practice statements relating to abortion. So why is it so difficult? Why do you envisage, why do you think abortion is giving room for young girls? Why? Why do you see the negative in everything good? Why? Why do you see the negative? There are conversations, there are honest conversations we're not even having around safe abortion. There are men in this present age and time who impregnate their wives and tell them, look, you can't have this baby. I'm not ready. I'm not financially capable. I'm not ready to father this child. Yes. And those men sit on tables where safe abortion is being condemned. Is that not hypocrisy of the highest order? Are we not being unkind to ourselves? That reminds me. Now, it is it is important for us to note that when we refuse to think logically, we are just joking with the fundamental sexual reproductive health rights of women. Yes. And what it means is that should your wife have need for that type of medical attention, she's never going to get it. Yes. You hear some men say, see, just save my wife, just save my wife. If the child has to go, just so be it, just save my. Now you there will be no such option anymore. Both you, both your wife rather and the child will go. You're going to be losing all round. You're going to be losing all round. This is so sad. This is so sad. Whether you legalize safe termination of pregnancy, it doesn't stop those who cut corners. It's still going on. People are still doing it. But we are advocating for those who genuinely, who have been proven medically unfit. I don't even want to go into the nitty-gritty of the conversation because on no ground should any woman be forced to have a pregnancy she's not ready for. Yes, if I've been raped and I choose not to have that pregnancy because I will never see myself loving the child. And the system does not even give room for cases like that. And where out of 10, how many have you heard of? There are a lot of children who lack motherly care, who lack fatherly love because they did not beg to be born, but unfortunately they are bearing the brunt of it all because stringent rules like this. Now I want to say this. There's a post by the Guardian on a young girl who died as a result of sepsis. The doctors could not treat her because of the present law on ground, and even though she miscarried the pregnancy, they were scared of going against the law, and so they could not do anything, and she passed on. These are I'm hoping our leaders are able to think this through deeply and thoroughly so that lives will be saved, so that women will stop losing their lives to maternal death. And I also like to add that safe abortion or safe termination of pregnancy is not is not a wicked act. It is not an escape from loss. It is not adults trying to escape the consequences of their action. It is simply it is simply um, a propaganda to save lives. It is simply um, going to give room for women to access holistic sexual and reproductive health rights. Yes. Now, let me add that sexual and when we say sexual and reproductive health rights, mm, it includes individuals' right to make informed choices about their reproductive health, including access to family planning, contraceptives, safe abortion, parental care, and comprehensive sex education. I just want us to please, if you come across this video, please think about it. Think about it. Please, please, and please think about safe termination of pregnancy, the pros and cons. The pros outweighs the cons. The pros outweighs the cons. And this is me appealing to us to please reconsider it, because a lot of women will lose their lives. A lot of families will lack motherly love. Please, when a pregnancy is not medically safe for a woman, let her have the right to get it terminated through the service of a professional. Please, let's stop seeing it as an avenue for young girls to engage in whatever promiscuous acts. Those are distractions. Those are distractions. Because whether or not it's legalized, people will be who they are. My concern, women who are of age. Some women struggle taking in, and by the time they do, it comes with complications, and at a point they just have to stay alive. What it means now is that no doctor can save you. Nobody can even take you. In fact, there are penalties. Oh, there are penalties for anyone who even encourages you to access abortion services. It's deep. Oh. Please, my people, please, please, and please. Thank you.